Today we are going to consider one important orthopedic condition or problem which affects most of the patients. This is known as avascular necrosis of the hip joint. Now most of our patients are aware of this term known as avascular necrosis, where the blood flow to the hip joint decreases, resulting into hip arthritis. Patients post-COVID are coming to us with this hip pain and difficulty in day-to-day activities, walking, sitting cross-legged, and when we examine these patients, usually they are suffering from what is known as avascular necrosis of hip joint. So today we will consider some of the points about avascular necrosis of the hip. Now, as you must have known by now that when the blood supply to the hip joint decreases, the bone starts dying, and because of this death of the bone, the hip ball or the head portion of the hip joint here, it starts becoming weak, and under the body pressure there is a collapse of the hip joint. This collapse results into arthritis and pain. Also, because there is a change in the shape of the ball, the range of the movement of the hip joint decreases. Now, how to go about it or how to treat it? Now, the most important investigation that will diagnose avascular necrosis is MRI of the hip joint. So, it is very important. If the patient is suffering from hip pain or restricted hip movements, then he should undergo MRI as early as possible. A good MRI will detect avascular necrosis in early stages and will help us to treat patients much better. Now, the hip arthritis or avascular necrosis of the hip is divided into early stages and the late or advanced stage. Now, first we will consider what we can do for the patients who have come to us in early stage. Now, if the patient reaches us before the shape of the ball is not changed, now these early patients, we can do a simple procedure where we try to save the hip joint and try to avoid the hip replacement surgery, and this is something known as decompression surgery or decompression of the hip. Now here on the model I'll just explain you in short what do you mean by a decompression. So suppose this is your hip joint. This is your hip joint which is necrosed inside, but outside the cover of the ball is still good. In that condition, we make a small hole here on the hip joint and we drill inside, remove all the necrotic area, and then we fill this gap with a fresh bone which is taken from the patient himself. That is known as bone in BMAC. So that we inject inside, and almost 80% of the patients can save their natural hip joint. So this is a very good procedure if we can identify the avascular necrosis in early stages. Now, if patient doesn't turn up to us in early stage, then usually the shape of the ball changes, and along with the shape of the ball, change in the shape of the ball of the hip joint, there are some degenerative changes on the acetabular side or on the cup side as well. In those cases, in the case of advanced osteoarthritis, the decompression is no more useful, and all those patients need to undergo what is known as hip replacement surgery. Now, hip replacement surgery or total THR or total hip replacement surgery is a surgery in which we replace both the femoral component, that is head of the hip joint, as well as the cup of the hip joint. So here we are changing both components, and hence it is called as total hip replacement. Now, in total hip replacement, we use something which goes inside your thigh bone. So here is a model. So if we consider this is your thigh bone, something goes inside your thigh bone and the head is attached to it. There are various heads available. We can discuss it in the next video regarding which head to go for and what are the advantages of different materials for the head of the femur. And this head articulates with the acetabulum side or what is known as a cup. So this is how the hip joint is replaced or total hip replacement is done. So this is all about avascular necrosis. If you have any queries, you can contact us